Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of April 24th, 2023. Following a status update on COVID-19, I'll talk about the recent Kaiser COVID outbreak, brief Mpox update, and I will go over the CDC's recent booster approval. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Taking a look worldwide, I'm moving towards reporting on these data, which are essentially comparing each country against itself over time. So here we're looking at confirmed cases over the last 14 days per country compared to the number of cases that country had in the 14 days before that, where the darkest red colors indicate the largest increases in cases. We can see that Vietnam, Libya, and the Dominican Republic have the most significant increases, followed by Sudan and Egypt. Vietnam actually is recording a 1900% increase, which is obviously very significant. And there are some reports coming out of Vietnam that their commercial hub of Ho Chi Minh City has reinstated masks in public places, including schools, because of the increasing cases. Taking a look at the United States, about 36% of the counties in the United States are in substantial or high transmission, and only about 18% are in low transmission. And you can see quite a bit of variability across the country, with the majority of, well, all of Arizona in substantial to high. Iowa is not reporting at all. And most of the Northeast and West Coast are in the moderate range. Taking a closer look at California, we can see that the majority is in the moderate range. A couple of counties, including Imperial County, way down in the south, are in the high transmission range. I'll touch on that more in just a bit. Taking a look at COVID deaths, we're starting to see that reporting is being updated less frequently these days. And we know that the process of validating and confirming all the COVID-related deaths does have a lag time associated with it. So here I'm showing confirmed US COVID deaths. Total so far for this pandemic is 1,127,411 total deaths. That is a lot of people who've lost their lives to COVID, and 32,800 of those have occurred in this calendar year of 2023. The provisional numbers do look a lot higher than this, but again, I'm just reporting only those that have been completely confirmed with the death certificates and all. So 32,800 confirmed COVID deaths so far this year, 2023. And the lowest weekly number of deaths thus far is 1,348. That was a year ago, the week ending April 23rd, 2022. However, when we take a look at this tracker from the CDC, and these are provisional numbers, so they're not the confirmed numbers from the last slide, but these are provisional numbers, and it looks like the week of April 19th, there were 1,160 deaths. So it does appear that we may have gone lower than our previous pandemic low that was a year ago, finally. But again, these are provisional death counts, and sometimes depending on how slowly the states are reporting, these can be increased over time until we get the confirmed numbers. But still, this does seem hopeful that we may have less deaths now than we did a year ago, finally. But again, April being our low month basically every year since the pandemic began. Taking a look at wastewater, just wanted to point out a few things here. There's quite a bit of blue dots, which is a good thing, I believe, because this hopefully indicates that we are at lower levels of SARS-CoV-2 concentration in the wastewater. You can notice here that little red dot at the bottom of California, which is around the area of Imperial County that I pointed out earlier of high transmission. So I just wanted to point out that correlation. So these are the things that we'll be wanting to keep taking a look at just to see what kind of conclusions we will be able to draw from our wastewater map, that hopefully we'll see that before we'll see the increase in cases. So we're still kind of trying to wrap our arms around how this can be the most useful. We can see here that there are still huge areas of the United States that have no sites reporting at all. And all of the white dots represent new sites that have been added since last time. So we have a total of 66 new sites since last time. So that's promising. And I hope we will continue to see more and more sites as we go along. Right now, the total number of sites with current data shown here is 1,213. Turning now to variant proportions in the United States, we can see that XBB.1.5, which at one point was almost up to 90% before starting to tick down. It's now at 73.6%. It seems to be slowly being edged out by XBB.1.9.1 and XBB.1.16. Those have been predicted to have increased a point or two since last week, but it's also highly variable across the country, where we can see that areas like Region 7 have quite a lot of XBB.1.9.1, predicted to be 26%, and other areas have much less. It remains to be seen if this will have significance in terms of driving surges, hospitalizations, and death. But so far, it appears that both 1.9.1 and 1.16 are not making people more or less sicker, about the same so far. They're just a lot more contagious, which is of course never a good thing. This is why we continue getting outbreaks, particularly as people start dropping protection. So we're dropping protections, even though we have much more contagious variants. And speaking of outbreaks and people dropping protections, Kaiser Permanente in Santa Rosa reported an outbreak this past Friday. They stated that more than a dozen staff, along with an undisclosed number of patients, tested positive for COVID-19. They released a statement that says, effective immediately, physicians and staff are required to mask in the Santa Rosa Hospital and Emergency Department while providing direct care. We're requiring all visitors to mask upon entrance to the hospital and throughout their visit. So that seems like a very reasonable policy that I cannot understand why it was taken away in the first place. This kind of outbreak seems pretty inevitable during an airborne pandemic where we still have so much COVID circulating around. So it's still baffling why some hospitals have chosen to remove masking. Fortunately, here in Alameda County, Alameda Health System, our county hospital system, has maintained masking in all patient care areas. And so we're very grateful to hear about that. But I would venture to say that for those systems who have dropped masks, we'll continue to hear news stories like the one I just described. Here in Alameda County, our current positivity rate is staying pretty high at about 6% positivity rate, but the number of tests being conducted overall continues to go down. Hospitalizations have ticked up a bit much. They were at 66 last week, now 79. 11 of those are in the ICU. And as you can see by kind of looking at that line that's going straight across, our baseline, our low points just keep getting higher, a little higher each wave. And so even though our highs are not as high, our lows are also not as low. So this is not a good thing. This is concerning because that just means that throughout the year, we're still seeing a significant number of hospitalizations, and the curve looks very similar for deaths as well. So far in total, we've had 2,228 deaths in Alameda County. And since about November of 2022, we've had about 1 death per day in Alameda County. So we're still losing our people to COVID. When we look statewide, we can see that people who are not vaccinated are still 2.3 times more likely to die than those who had at least the primary series. So this is state of California. This is the month of February, so fairly recent. 2.3 times more likely to die if you're unvaccinated compared to those who had at least a primary series. So even though there's all this talk about having been infected and how that's giving some protection, we can see clearly here that in reality, there's still a discrepancy, a very significant discrepancy in the death rate between people who got a primary series and people who are unvaccinated. 2.3 times more likely, so more than double. And so anyone who's still left unvaccinated, we're still concerned about those folks. We are wanting to continue to have those conversations. Likewise, people who are unvaccinated are 2.5 times more likely to be hospitalized with COVID-19 than people who got their primary series. So again, more than double the risk of going to the hospital, more than double the risk of dying for those who are unvaccinated. So we don't want to forget about them. And remember, many of them did not want to receive the mRNA vaccine. So we need to make sure that they know about the Novavax option. This is a protein subunit vaccine, so it's a little bit of the more old-fashioned type of vaccine formulation. So make sure your friends and family who were not comfortable with the mRNA for whatever reason are aware of this option so we can go ahead and get them protected. They remain at risk even if they've been infected before. Briefly on Mpox, I just wanted to touch on this recent publication that came out of France. Then it was reported by the University of Minnesota, CIDRAP, which is the Center for Infectious Disease Research and Policy. They've been putting out great stuff throughout the pandemic. And they reported a small cluster of 17 individuals in one region in France. And there was no common event or gathering that all of these cases were tied to. And this is in the setting of pretty much no cases in other regions of France. So it's a cluster, they're calling it. And what was significant about this cluster is that 59% of them were considered fully vaccinated. So you'll recall that the Jynneos vaccine was deployed quickly and very efficiently during our outbreak of Mpox last summer. But we really haven't had enough time to see what the real world effectiveness of the vaccine is, how long it lasts, and any of the particulars. So it's definitely concerning that there was a high proportion of vaccinated people in this cluster, and these were people who got disease. So they ended up with a rash. None of them got sick enough to be hospitalized, so that's good. So we just don't know, how much protection or what type of protection the vaccine series offered. And again, this is a very small cluster, but it's just a little bit of a cautionary tale. So I think we just need to remind ourselves we have a lot to learn. I think the main thing is that it's not a relaxed kind of situation. We still want people to be cautious, still protect themselves, and we still have to be vigilant, and we have more to learn. And as I reported a few weeks ago, we do anticipate that we could see increases of Mpox again this summer for those in those high-risk categories. So we definitely want them to get fully vaccinated, and we want them to still exercise caution and be vigilant till we understand more about this. And so for now, we are still saying it's still this 2-dose Jynneos vaccine series. But once again, I think we're going to hear more about whether we need updated vaccines or more doses or how long the protection lasts and so on and so forth. But just wanted to give that quick update that it's still possible to get Mpox with symptoms even after being fully vaccinated. And lastly, I wanted to talk about the updated vaccine news, which I'm sure everyone's heard about. The CDC signed off on an additional booster for everyone 65 and up, as well as anyone who's immunocompromised at any age. And that is with the bivalent booster, the same booster that's been available since last September. And in fact, the regular monovalent vaccines will be going away completely. The ACIP, which is the committee that advises the CDC, spent a fair bit of time talking about their goals and reflections when they met last week as it relates to their vaccine and booster strategy. And of course, they underscore how important vaccination continues to be in order to prevent serious illness and hospitalization and death. And no, the vaccine is not stopping transmission. That's not what it was ever intended to do, although that would have been really nice. But what it is intended to do is to prevent hospitalization and death, and it is continuing to do that rather well. But we do see that in our older age groups, and certainly in those who are immunocompromised, the effect of the protection from severe outcomes does appear to start decreasing after some months. So somewhere in the 4 to 6 to 8 month area, the protection against severe outcomes starts to go down. Also, the uptake of boosters is still way too low, even among those who are at high risk. Overall, in the United States, only 16.7% of the population has even received their first updated bivalent booster dose. And even in the 65 and over group, only 42.4% of those adults over 65 have received a bivalent dose. So I'm actually most concerned about that almost 60% of those over 65 who haven't even gotten their first booster dose. So that's what I'm most concerned about. But now that group is eligible for a second. And the reasoning again is because for those at higher risk of bad outcomes, the protection does appear to wear off. And I reviewed this in quite a bit of detail about a month ago. I linked that past briefing in the post. I reviewed a large meta-analysis that took a look at this. So it wasn't just looking at antibodies and saying those wear off. We know that the antibodies wear off, and that is not the only thing that's helping us fight infection. We have a whole second line of defense. But what these studies was looking at was not just antibodies, it was looking at the rate of hospitalization and death. And they did see that it started to drop off after some months. Little variable from study to study, but dropped off nonetheless. So we're starting to see that it would be beneficial that for those groups that they be able to get yet another booster. So I still think we have a lot more to learn on this because there's so many variables, like how many times you've been infected, how long since your last dose, the spacing of the doses, all of those things. But there's not like a formula or anything at this point. And so what the CDC has done here is give quite a bit of flexibility and discretion for, especially for your primary care doctors, to work this out directly with their patients. But if you are 65 and up or you're immunocompromised at any age, there is no question that you are eligible for another bivalent booster dose, as long as it's been 4 months since your last bivalent booster, if you're over 65, or if you're immunocompromised, if it's been at least 2 months. And the ACIP made it clear that they really want to simplify things. They want to simplify the recommendation so that they'll be easier to communicate and to just streamline the process overall. So as you can see here, one of the things that will happen is that we'll have less types of vaccines to choose from. Things will just get a little more straightforward. There'll be pediatric and adult, but the monovalent will go away. So we'll be left with just the bivalent vaccine. And we still have the Novavax, which I mentioned earlier. And the Johnson & Johnson vaccine doses will expire by May 6, 2023. And I haven't heard anything about that being replenished. But since we know that the pandemic response will become commercialized, we know that many of these things will move into the insurance markets. So it's going to be mostly supply and demand, and it will depend on what arrangements the insurance companies make with the pharmaceutical companies. But for now, we are being reassured that these vaccines will remain available to everyone free of charge. It might just be different how you access them or where you get them, but they should still be free for everyone. They discussed programs for the uninsured. They even talked about a better vaccine program for adults, more like what we have for children that covers all vaccines. So that would be a great outcome of this crisis if we could get better vaccine access for all vaccines for adults. So this is something we're going to definitely be keeping an eye on. But still, even with better access, we know that the best access you can get is through your primary care doctor. So if you do not have one, please get one. Please make a treatment plan. We have good outpatient treatments that can reduce the risk of hospitalization and death from COVID. If you or someone you care about is not vaccinated and they catch COVID, it's even more important for them. But anyone vaccinated or unvaccinated who is at risk of a poor outcome should receive treatment in a timely fashion. This is something to discuss with your primary care doctor ahead of time. Paxlovid is still considered the first-line treatment. Most people can receive it, but there are certainly groups where it may be more difficult or even not possible to get Paxlovid. And in that case, we have remdesivir, which is a perfectly respectable second-line treatment. The biggest issue with remdesivir is that it is IV for 3 days in a row, so you have to go in 3 days in a row to get it. But we know that an oral form of remdesivir is currently in trials, so we are hoping that will become available soon. But still going in 3 days in a row to prevent unfortunate hospitalization or death is certainly worth it. So if that is your plan, you're going to make sure with your doctor that you know where you're going to get it, how you're going to get it, and so on. And this is, again, what we want to work out before you catch COVID. And we'll really be looking forward to hopefully that second choice becoming an oral treatment. But in the meantime, we have molnupiravir. It's not nearly as effective, so it's definitely the last resort, but it is another potential treatment option. In summary, we are in a bit of a lull with SARS-CoV-2, as we have been every April for the past few years. We can definitely be grateful for it, but it doesn't mean let our guard down, because there's still quite a bit of it circulating. And with precautions dropping, we are seeing outbreaks, even in hospital settings, like I mentioned. Even in a lull, we have too many people being hospitalized, too many are still dying. And we'd be wise to prepare for increases over the coming months, like we've had every summer since the pandemic began. We are still losing unexpected numbers of people to post-COVID heart attacks and strokes. We're seeing too much post-COVID new onset diabetes and other longer-term impacts like long COVID. And we're still learning about all of it. We're learning about all of the effects of COVID infection and reinfection. Still very new. We're still in the baby stages with this. So if you'd like to avoid a potential bad outcome or potential post-COVID effect or long-term COVID effects for yourself and others, please do what you can to avoid getting infected or reinfected or spreading it to others. Gathering outdoors is always safer than indoors. Make efforts to improve your indoor air quality. If you must spend time indoors with others, especially members of the public, wear a high quality filtration mask like an N95, a KN95, or a KF94. Consider using rapid tests for pre-event testing. Also, know how to reach everyone that you gathered with in case somebody turns up positive. If you get exposed or if you have symptoms, repeat the rapid test every day or two while you continue wearing a high filtration mask. And if you or someone you spend time with unmasked would be treated if they got COVID, go ahead and get that more definitive PCR test. So that way you can get that timely treatment, because remember, we only have about 5 days to get the treatment started, and the sooner the better. Please don't show up to work or school or go out in public or go out on public transportation if you're not feeling well. Staying home and resting is best. If you absolutely have to go out, wear a well-fitted N95 mask. Remember to eat a balanced diet. Let's incorporate some fresh fruits and vegetables and whole grains. Let's avoid those sugary drinks. Consider a multivitamin supplement. And let's get those baseline labs checked, get your blood pressure checked, get some regular physical activity. Unless you're sick, then please rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.